Hi, I'm Samantha Olds Frey, the CEO of the Illinois Association of Medicaid Health Plans, also known as IAMHP, and I want to thank you for joining today's Executive Corner. We're going to talk about the legislative session, public policy impacts for the Medicaid program, and what we see going forward. To just remind everybody, in Illinois, on May 31st, when the clock strikes midnight, things change. After the 31st of May, you need a supermajority to pass anything with an immediate effective date. And so what we see there really is a clock ticking. And after May 31st, all of the big items typically need to be done. These include things like a state budget, Medicaid omnibus bill, and other policy packages that are going to impact Illinoisans throughout the year. So that happened this year. Once again, the legislature took on a laundry list of items, including redistribution or redistricting is required by the Constitution every 10 years, took on Medicaid omnibus bill, obviously the state budget, the energy package, cannabis reform, elections, just ethics reform. So tons and tons of items. The legislature was very active, coming right in off of a pandemic that we're still dealing with, still grappling with. And so we want to talk today about what was done, what that means for Illinoisans, what it means for the Medicaid program, most importantly from our perspective, and then what we envision going forward. And finally, where you can find more resources, both at IAMHP on our website and on our podcast. So let's dive into the Medicaid omnibus bill. This was, as always, is sort of every year we see Medicaid reform done, and we saw that again this year. Bipartisan working group talked together, negotiated a Medicaid reform package that does some really important things from our perspective about improving and benefiting the Medicaid program, and things that I want to highlight, because there's a lot in the bill, and we'll probably dive into more of it as we go forward. But things I want to highlight first and foremost is an increase to the payment rate for the administration of vaccines for childhood vaccinations. And we think this is so important. So first of all, as a reminder, the Medicaid program covers about a third of the children in Illinois. So children's health care in general is critical to the Medicaid program. But second, we've seen really a snowball effect on vaccinations, both from Medicaid policy changes that happened in the past administration, but then also COVID, and families not going into their doctor's offices, not getting vaccines. And so we've seen vaccination rates just plummet. And so increasing that reimbursement rate, bringing doctors back into making sure that they're vaccinating Medicaid children is going to be a critical tool in sort of digging us out of this hole that we found ourselves in from a vaccination rate perspective, especially when we think about coverage for a third of the children. The other item that we know is just so critical is an increase to the dental rate. So we have pretty low reimbursement rates in the Medicaid program for our dentists. We did see this year an increase in the rates of $10 million. It's an important first step as we sort of make progress on reimbursement to improve access for our Medicaid members. And so those are the two things I really want to highlight in the Medicaid omnibus bill. There's a lot more we'll dive into, but those things I think are going to make the biggest impact on the Medicaid program. The next item that's going to have a huge impact is a stable budget. So I think we have the best budget we've had in the state of Illinois for about a decade, if not more, really. And that is in large part thanks to the federal investment through the American Recovery Project, and the federal dollars that we've seen come into Illinois that have allowed the state to stabilize, to make one-time investments that'll decrease operational costs going forward, and really find ourselves in stable footing so that in years coming forward, we can really build and invest and improve on outcomes within the Medicaid program. Here in Illinois, for the first time that I can remember in a long time, we have a 30-day payment cycle, which means the state of Illinois is paying their vendors within 30 days, which is average and normal, and elsewhere or in a private business isn't something you would really note, but in Illinois is significant. And so that is something to really underscore, that it adds that stability that we all need if we're going to make investments, because investing while people are in crisis doesn't make a lot of sense from a public policy perspective, but investing while we're stable and while we're sure-footed is going to bring about the best outcomes for the people that we're serving and for the providers and organizations that are going to be doing that transforming and that innovating. And that really leads us to sort of our third item, which is what do we expect going forward now that we found sort of the stable footing, hopefully going for now. What I anticipate is that we're going to have discussions in the Medicaid program and in healthcare about how do we align financial incentives for outcomes. We already see this in the Medicaid space with the Medicaid health plan. So Medicaid health plans have what is called a quality withhold. A portion of the payment that goes to Medicaid health plans is actually withheld, and is only paid if quality metrics are reached. And so this is significant because it typically what is withheld equals about the margin that health plans hope or anticipate making. So if they don't meet those quality benchmarks and they don't improve patient care, there's really no margin for them. So that's critical for moving the system forward. But that's just one piece. Medicaid health plans are just one piece. What we really want to get towards is a place where everyone's moving together in the same direction. And so this is things like hospitals, doctors, FQHCs, and of course our nursing homes as well. And so I anticipate that in the coming years, you will start to see more discussion around how do we reimburse these providers? How do you reimburse in a way that incentivizes quality, but also gives the resources needed to make those investments to bring about that quality? And so I think that's what we're going to see in the coming years. I really look forward to that discussion. I look forward to having that discussion when we're on stable footing and we're not seeing providers close their doors left and right. And so I think, from my perspective, Illinois is in a really strong position to continue to invest in the Medicaid program, to continue to serve well the over 3 million people who rely on Medicaid as their healthcare safety net. And if you want to learn more, you want to sort of understand all that happened or some of all that happened in Springfield, please do check out our latest podcast with Kareem Kenyatta, IAMHP's consultant. We dive into the legislative happenings and what we see, both from my perspective, but then also from Kareem's big picture, full state budget, but then also the Medicaid program and healthcare in general. So thank you for joining us on today's Executive Corner. Stay well, and do not forget to check out our website, imhip.net, and follow, like us on social media, Facebook, LinkedIn, and Twitter. Thank you and have a great day.